All right, good evening. Welcome to Game Changers. My name is Jeff Standridge, and very glad that you're all here. For those of you who are logging in via Facebook Live, we appreciate you for being here. We actually are having our first live Game Changers event for the first time in about 15 or 16 months. And we've been having our health sciences entrepreneurship boot camp. So we have students, college students, upperclassmen at the undergraduate level, immediate postgraduates, and graduate students from 7 different universities around the state. We've been hosting them on the UCA campus all week this week to learn about everything having to do with entrepreneurship and health sciences and the intersection between the two. Tonight, we are very pleased to have with us a leader in healthcare in Arkansas, Mr. Curtis Barnett. It's great to have you with us. Great to have you with us. So, Curtis, I always like to start out by stepping away from Curtis, the leadership figure, Curtis, the Arkansas business figure, and let's step into kind of the origin story, or the family background, education, what have you. So, start as far back as you want to go, and we'll come forward from there. Let's just know about you, the person.
Sure. Yeah, Jeff, thank you for having me. First of all, it's great to be with you, especially your first night back in person. But for me, probably a good starting place would be with my parents. And my dad is from Romance. If you know where Romance is in White County, and my mom's from Bologna, not far away. They married, moved to really the Sherwood, Silver Hills, North Pulaski area after they got married to build a better life. Both of them came out of tough circumstances. My dad worked for Timex in Little Rock for about 40 years. My mom worked at the Sears Automotive Center in North Little Rock, Pain Mall for over 30 years. But my dad started, he was a material handler, which is the absolute entry-level ground floor position at Conductor, worked his way up into management. And I tell people all the time that I never saw him take a shortcut on anything, and that I was born very wealthy because my parents loved me, supported me, and had high expectations for me. So in many ways, I'm just the luckiest person in the world. So anyway, I grew up in Sherwood, graduated from Silver Hills High School, and from there to the University of Chicago.
Go Bears.
Go Bears, that's right, go Bears.
I actually know where the Timex plant is because I was in the National Guard unit right around the corner from it.
That's right.
Yeah.
That's right. I spent a summer working at the Timex plant. That may be something we get into later, but especially during my college years, some of the best experiences of my life were working in factories. And I worked in the Timex factory one summer and worked in the Burco factory 2 summers here at college. And you want to learn about teamwork. You be part of a production line with about 10 to 12 other people, and you're number 2. And they're paid on that team, basically performing well over an 8-hour shift. That teaches you a lot about teamwork and responsibility and working well with others. And it really gave me life lessons that have carried me throughout my life. But I wouldn't trade those days and the people that I got to work with, the time I got to spend with them, were some of the best people that I've ever known. And treasure those days.
So you came to UCA. Tell us about that experience.
Well, I came to UCA and was probably about as average, luckily, if I was even average, as anyone could be. Came out of high school, was kind of an uninspired student, pretty good grades, an average athlete at best at a time, and that seemed to be pretty important. Didn't really want to go to college. I looked at, thought I wanted to work on an oil rig for a while over in Oklahoma, looked at that with my best friend, then looked into being a tool die maker, and that has a possibility. But my dad just kept, begging me to go to college. He never had that opportunity. Neither my parents never had that opportunity. No one had that opportunity. I have a sister who's 2 years older, but grandparents never went. Aunts and uncles didn't go. So it was very, it was a dream so he just kept after me. So then I finally said, okay, I'll go to college. But I had a good friend who had connections to Oklahoma State. And I said, well, I'm going to go to college, I'm going to go to Oklahoma State. So then my dad shifted from go to college to go to UCA. Go to UCA. My sister was here, and he just felt like that was the place for me, the place that I needed to be. So I came, and there were probably 20 or so from my graduating class who came. And if you ranked us 1 to 20, who was most likely to be, to graduate, walk out of here with a degree, 4 or 5 years, I probably would have been in the bottom quartile. I don't think that people would have, if you had to bet. And but I liked it. I enjoyed it. I made friends. I was at a session a couple of weeks ago, and Dr. Tom Williams, who's a dean here at UCA, and I heard him use the phrase I'd not heard before, but he was talking to a group of students, and he said, when you find your community, you find yourself. And that's what happened to me at UCA. And I found it to be just an extremely nurturing and encouraging environment. And it allowed me to think of things and to see possibilities that I never thought of before. So it was the absolute best place for me at the best time, and really has played a pivotal role in the success that I've enjoyed.
Great. And you majored in?
I majored in, I was political science, economics, public administration. That's kind of the area that I was in. Got my bachelor's degree here. And so really, learned to write well, communicate well, critical thinking skills were absolutely critical to getting a degree. So, just a great opportunity here. I had so many professors who took an interest in me and would spend time with me and would challenge me. And, and I really thought, at that time, that was my career. That's really the arc that I was on. My parents, absolutely wonderful, but they didn't go to college. We didn't have friends who were accountants or attorneys or people like that. So they really didn't, I don't think at that time, knew where to direct me. Okay, why don't you go into this field, which was probably a good thing. So they didn't really direct me at that point. It was just important to them that I be here. And I think they felt confident that once I got here, once I settled, that I would find my way. And so I began to, my professors took interest in me, and a lot of them began talking to me at that point, saying, this is a pretty good life. Being a college professor is a pretty good life. You can live in a college town, which are typically great places to live and raise a family, and you're not going to get rich, but you're going to have some enriching experiences and working with students and doing research and all those things. So that was really the path that I was going down. I was possibly going to get a master's degree, PhD, and then eventually teach, and then possibly move into higher education administration and do that. And so one of the things that really opened my eyes at that time is one of my professors. It was Dr. Charles Dunn. Dr. Dunn was a political science professor here for a number of years. Was also the head of government relations for UCA before he was named president of Anderson State University, which he served in that capacity for over 20 years. And he in particular had played a big role in being a mentor for me. And I would go by his office. He'd spend 2 hours with me just talking about, and I would hear how he viewed the world and the things that he thought about. And it was just fascinating. And I was just asking questions, over and over again. And so anyway, he just encouraged me to one day to run for president of student government. I was a sophomore at the time. And, it was one of those situations where I was kind of too dumb to know that, quite frankly. And so I did it. And I ran against the incumbent vice president, who was going to be a fifth-year senior. And he was running for president, and I ran, and I beat him. And I was elected president of the Student Government Association while I was here. And that opened up all kinds of opportunities and new experiences to me that I've never had before, never thought of before. So it's all of those things come together. And a big part of what they did is it gives you confidence. And I tell people all the time, confidence, you can be equal on talent, you can be somebody with confidence, and you believe in them and encourage them. When they get that confidence, they can get the world by themselves, accomplish almost anything. And I've certainly felt it.
Very good. So, your family, you have one son.
Once I'm married, I've been married 26 years now. We had our anniversary about a week ago. Sick of Bible, thank you.
Happy
And
anniversary.
26 years with wife Karen, and she is my partner in all things. She's my compliment. She's the good things in my life. She's at the center of all the good things in my life. We have a 24-year-old son who's in Memphis. And he'll probably eventually, I was telling Jeff beforehand, eventually go to law school, but right now he's just kind of living his life and finding his way. Something that we all need to do.
So you graduate from UCA. What's your first job out of college?
The first thing I did next, again, I thought I was on the higher education, kind of trying to move into that way. So I went to Fayette, the University of Arkansas Fayette. Got a master's degree in public administration.
Okay.
Really thought from there what I intended to do was get a PhD and teach either political science, public policy, something in that area. It's really what interested me. So I finished up at the University of Arkansas, got my master's degree, and been accepted to the University of Texas into their PhD program. But you get to that point, some of you may be able to relate, where you just get tired of eating ramen noodles, and you're just poor all the time. And so, man, I'd really like to take a break, and I'm going to take a break. And people will say, "No, take a break, and never go back." Well, no, I'll go back. Everybody that I would, so I took a break. I never went back. And so I took a break and got a job. And my first big job was with the University of Arkansas System Office in Little Rock, which I think probably most of you are aware kind of how that functions. And I was hired as a research associate. So my job was to do institutional research. I did enrollment studies and things like that. I did a lot of financial reporting and just did work like that. And then in 1989, the university, U of A at that time, they had one health plan for all their employees. They were looking about their third year in a row of like 20% plus health insurance rate increases for their employees. So they said, this is enough, we're going to make some changes. So they did what universities are apt to do. They formed a committee and put a committee together and studied this from all the campuses within the university. And said, we're going to study this, we're going to make recommendations, and we're going to chart a new path for the health plan. And so I was asked as a research associate to staff that committee. That's basically what we did. We hired consultants to come in and do some work. So I was the person pulling the data together, just all the work and support of that committee. So it was really about a 6 to 9 month just indoctrination in health insurance and understanding what the issues were and what drives utilization, what drives cost, all these different things, and the decisions that were made. And so we got to the end of it. The university at that time, they had over 10,000 employees. They were large enough. So basically, we're going to take more control over our health insurance plan. So we are going to self-fund our health insurance plan. What that means is basically we're going to hire a health insurance company to process the claims, answer questions, and we're going to determine what the coverage is. We're going to determine who's eligible and who's not. We're going to determine what the funding levels are. So we're going to take more control of it because we're large enough that we can basically, our risk, we're large enough to take the risk, good or bad with the plan. So got to the end of that, and I'll never forget. So they formed it, got approval from the board of trustees to do that. And there was some talk about, okay, we formed this thing now. Somebody's got to run it. Somebody's got to do it. I was, mid-20s at that time, 25, 26, maybe 27 years old. And I'll never forget that a gentleman by the name of Gary Chamberlain, who was the executive vice president for the University of Arkansas System at that time.
My doctoral chair.
Doctoral chair. And he is at that time. Can I stand up? At that time, you could smoke indoors. And so Gary smoked, and he smoked indoors. So he stands. He comes to my doorway in my office. office one day. Gary always wore his tie, but he never buttoned his top button. And he's standing there in my doorway, he's smoking a cigarette, and he says, you know, we've put this new health plan together. Takes another puff. He says, and everybody's saying we got to have somebody run it now. Takes another puff, and he says, I'm getting advice from everybody. So I got to do a national search. Got to do this. Got to do this. What about you? He said, you think you might want to try it for a while? And before he got it out of his mouth, I said, yes. I had worked on it for about 6 to 9 months. I had barely been off of my parents' health insurance coverage. I could barely spell the word deductible. But I knew this was going to be an opportunity that comes up. And I knew, I guess, at that point, you might not always get those opportunities. So I had this opportunity, so I said, yes, I'll do it. And so Gary let me do it. I was put in that position, ended up building a little staff. We had success. Our rate increases moderated. We built nice reserves. Things came together in a real good way. Ended up, had other opportunities in property and casualty as a result of that. So it was a great opportunity. It was hard work. I was learning on the fly. It was kind of one of those sales like so there was some of that going on, but it was just great fun and great work and just an outstanding opportunity that I got to do. But I was I've done it for a few years then, and I said, okay, so what's next? So if I stay with higher education, I've kind of gotten off the PhD path now and going that route. So what do I want to do going forward? So if you're working in benefits, a lot of times human resources is great, important work, but that's not really what I was really wanted to do. And then on the finance part of that, I didn't have a CPA, so I didn't really feel like that. So I said, I really like this health insurance stuff. I said, this is going to be a big deal for a long time. I can see that. Well, if you're health insurance and you're in Arkansas, where's one of the first places that you look? If you think that's where you want to work long term. So that relationship, knew some people with Arkansas Blue Cross Blue Shield, thought about them, and applied for a position with them. They had opening new product segments, and they hired me. So I made the shift out of higher education into private sector, working for Arkansas Blue Cross Blue Shield, and that was nearly 28 years ago. So
wow. Been there ever since. And so talk to us about some of your career experiences in Arkansas Blue Cross Blue Shield. You moved over into a product.
Moved into a product. We had a product at the time called the Primary Care Network. And what the Primary Care Network was, it was based in really in rural Arkansas was the basis. Really the foundation of it was, again, you had large self-governing employers. These tended to be plants and mills or locations of national employers. So, for example, an example would be Conductor and Batesville, American Greetings up in Osceola, Georgia Pacific, and Ashdown were companies that I worked with. And so they were in rural parts of the state. They were facing global economic pressures. And this was a time, this is the early 1990s. There was always this pressure to outsource jobs overseas. They were trying to maintain their workforce. Again, these wonderful people that I worked with at Timex and at Berco. And so these were the kind of people that they were working with in these plants and these factories. And so they were located in these small towns who had maybe 4, 5, 6 primary care physicians in that town. They had a rural small hospital, and they were all dependent on each other because this was the major employer in that community. They needed this stuff as well to keep that healthcare infrastructure in place in that community. So our job was really to work with the 3 of them, and we would work, we'd set a cost budget, we would come up with means and ways to control healthcare costs. We funneled all the care through the local primary care physicians. They would make the referrals whenever possible, when it made sense, they'd make referrals to local hospitals. The local hospitals benefit, as well as then control referrals outside the community as well. So it created a good local healthcare model in rural Arkansas. And we had a lot of success with it, for a while, but eventually I think economic forces overcame a lot of that. But it gave me terrific insight that I use today on the challenges of rural healthcare delivery. We're talking about that before we got started. And really attracting doctors and keeping doctors and hospitals and other healthcare professionals in the rural parts of the state. So it was just a great experience and gives the employer perspective and what they're looking for. And again, they're not just, yes, they want to support that local hospital, but that local hospital can't provide good quality care at affordable cost. They're going to refer, they want the care to go somewhere else. And so it really got everybody aligned and working together in a very positive and sustainable way.
And so you've been CEO of Arkansas Blue Cross Blue Shield for how long?
Since 2017.
2017. How many employees you guys have?
We have 3,200 employees.
3,200 employees in multiple locations.
Multiple locations. We have our corporate headquarters in Little Rock. We have 6 regional offices around the state, as well as retail centers as well. One thing people may not realize, we serve about 2 million members, and a pretty good percentage of those are actually outside the state of Arkansas because of some of the large employers, Arkansas-based employers, who are our customers and have employees who live outside the state. So we have a footprint that actually extends outside the state of Arkansas, really to all 50 states that we end up operating in.
Very good. Well, let's shift a little bit and talk about leadership. Talk to us about some of your best on-the-job learning experiences around leadership. Do you have an example or two that you could share with us, perhaps?
Yeah, I mean, probably one that comes to mind that was, again, it kind of fit a little bit of what I talked about earlier. I had worked in the primary care network. I then moved into product development. Then I was a business lead over our managed pharmacy program, trying to help control prescription drug costs. And then we had a business unit at this time. This was prior to 2000. So this was the Y2K. Everybody was worried about Y2K and making sure your systems were compliant. And so we had a system that we were concerned about. And so we were moving to a new system. The company had made the decision, and I wasn't working in the unit at this time, but this was an area of the company that, again, served some of our largest high-profile national customers at the time. I mean, companies like Potlatch, Warehouse, I mean, name-brand organizations. And so the division that served them was going through this big system conversion. And quite frankly, the project was not resourced appropriately, was not managed the way it should be, really from the top. And it got into trouble and began to have big service issues even before, because they're trying to do all this work done before January 1, 2000, and began experiencing all kinds of troubles, couldn't get claims, medical claims paid, service problems, all kinds of, just about everything that could go wrong was going wrong. We had some outstanding people who were leading the project and just quite frankly got burnt out and asked to be reassigned somewhere else in the company. So our chief operating officer at the time, a lady by the name of Sharon Allen, called me one day, "Can you come over?" And she begins to, I heard about it through the company, she begins to talk about kind of the state of this division and what the challenges were. And she said, "And would you like to," and before she should get the words out of her mouth, I said, "Yes, I'll do it." Yes. Because again, it's one of these big opportunities you just know that they're just rare.
Put me in, coach.
Put me in, coach, exactly. So I said, "You put me in, yes, I'll do it." And so I did, I started that. And a couple of really big leadership lessons occurred with that really changed not only my career, but my life in a lot of ways. And so we had so many service issues at that time. It's like, where do you start? What do you do? And so first thing you did, we had management staff and others who were burned out, they were tired, they wanted to do something else. And some of them, you had to re-recruit them, say, "Stay with us, we can make this work." And we had some people that belonged from other parts of the company who had a passion for it and enjoyed it. And so, you convinced them to stay with us. So it's basically rebuilding the management. And so rebuilt it, recruited them, and really got just an absolute wonderful group who had the kind of same vision I did, the same passion I did. And so So they were committed. So had that done first. So then we said, okay, what is our turnaround plan? And so we worked it up and said, here's where we think we can be in 60 days, 90 days, 120 days. So, well, we had customers at that point who were saying, we've had enough, we've been patient with you, we're out of here. So I went on the road. And so we've got marketing staff, and I would go with the marketing staff and meet with all of our customers and go over this turnaround plan with them and say, please stay with us, stick with us longer. We're going to turn this around and we need you to stay. And most of them said yes, but not all. Certainly the vast majority of them did. And like most of them, they wanted answers. And they wanted some degree of certainty, and we gave them that confidence. That's why I was spending my time, a big part of my doing. And so then I started hearing that we had employees. So we had about 125 employees in this division. And so some of them, really the frontline people who could make the work happen, they started saying, we think this thing's about to go on. We're going to start looking at other places in the company or outside the company, and we're going to start looking for other jobs. And so I started hearing about that then. So I said, I got the management team, I got the customers on board, I got to get the employees on board somehow. So I said, I want to meet with every one of these 120, every one of them. And meet with them individually and talk to them. And I had my pitch where I wanted them to stay. And I think we ended up scheduling about 70 of the appointments, what we had. And began meeting with them, all hours, trying to fit everything in. And what happens, what's the first thing you do when you sit down? You ask them how you doing. And guess what? People tell you how they're doing. And they began to tell me how they're doing and tell me about their lives. And you got a real picture for these 70 or so people that people's lives are miserable and they're magnificent and they're all things in between. And out of the 70 or so people that I've talked to, I bet you I didn't get down to my final points of here's why I would like for you to stay. Usually by the end of that session, when I would say, here's let me tell you why I want you to stay. You say, you don't have to say anything. I'm not going anywhere because I've never had somebody who'd spent that time with them before. So what it really taught me was don't be afraid to lead with your heart. And really the way that I operated before then, kind of the way that I conducted myself, I think most people would have said that I was professional and pleasant, but I was kind of Mr. Business. I had kind of this invisible wall right here. I didn't let people get too close. And then after that, it became, Jeff, and I knew now about your kids and things like that. And that human connection was there in a way. And fortunately, I loved it and embraced it. And it became a big part of who I am then and who I am today. And it's something that I absolutely would not trade for anything. And it really came out of that experience. And don't be afraid to lead with your heart and make that connection with people is one of the lessons that I learned. It will pay dividends over and over and over again if you'll do that. And the second thing, just real quickly, is kind of about the same time was so we lost some customers as well. So what typically, so you got revenue going down. Now you still got your big expenses. So what do most companies do when that happens? So what most divisions do? Cut expenses and revenue. And I remember reading the Arkansas Democrat Gazette at the time. Again, this was early 2000s, and there was a city in Arkansas who had lost their two largest employers in that community within about a year of each other. And so it had really devastated the community, and the tax base, the schools, and everything about that. Now, I remember they brought in an economic development consultant who came in and talked to them about that. And he said, the first thing that communities usually do is they go out and they try to recruit two more big companies in, and they give away their tax base. They just basically all kinds of tax credits and do everything they can to attract that. that company, and he said what he recommended doing is take that money and invest in your training, workforce training, or invest in your infrastructure, do those things, and attract and then build a more diverse economy in your community. And I thought, man, that's so good. I'm going to use that and apply to this division. So work with my team, we put together a plan, and basically went to our senior leadership and said, please don't make us do this. Don't make us cut our expenses down because we're afraid we begin laying people off, lose a job. It creates that fear and panic again, which could lead to others. It creates, potentially a death spiral, which you get into. So let's take a long review and let us basically run that deficit for a little while and let us reinvest in our processes and our training of our people. And we did that. We became part of the AIPE program, our quality board process at the time of the Arkansas Performance Improvement Excellence Program. We became part of that. So we went through that rigorous exercise, which is all based on the College Award criteria. We ended up winning, I think, the second highest level, award. So it gave us not only credibility, it gave us confidence, and it gave us a calling card that we could take out to our customers again and say, look, this is who we are. We've improved our service, we've improved our quality, and this is validation. So the second part of this, the first part, don't be afraid to lead with your heart. The second part of this, always keep the long view in mind, and especially during hard times or tough times. When you feel like you get that pressure, you got to do something. That's the time you probably need to be thinking most about, what is that longer view, and keep that in the forefront. Very good. Any particular failures that you would care to share that you learned from as a leader? Probably, there've been plenty. No question. But one that comes to mind in particular is when I moved out of the primary care network role, went into product development, and thought, I was going to do whiz bang, and all this success is going to come. I was going to create all these new products and all these things, and ended up taking on a project that where we were going to partner with a more regional company on a new product. We didn't have the expertise. We had the market. We had a local presence. They had the expertise. They had the scale. They could bring. And so there had been some significant amount of work done about 18 months prior to me moving into that role, where both organizations said this makes sense. Yes, shook hands. We're going to agree. We're going to do this, and it didn't move forward at that time. And I don't even know the reason why at that time it didn't move forward. So it got set aside. Kind of the pause button was set. And so then it came back 18 months later, and we picked it up again. So us and the organization both picked it up. Other organizations picked it up about the same time. And it was somebody who, very similar to me, a gentleman kind of the same part of his career at the time, and he was just an outstanding person. But what we never did, we never went back and revalidated that we had a shared vision. We never came back and said, do we both have the same commitment and priority that we had 18 months ago? We just tried to pick it up where we were a year and a half before and start up from that point on. So we missed some critical steps. So he and I were just spinning our wheels, working. Trust was never an issue, but all these other things were. And then when we got to the end, we had a failure, but we sure didn't have a success. And it just felt like, yeah, we sure did work hard, and we came out with something on the other end that was just kind of average, mediocre at best. But again, when you look at today's healthcare environment, you look at everything, the importance of just business in general, partnerships. Those were such important lessons that I learned, again, about shared vision. Be sure that you have that, with the person or the organization that you're looking to partner with. Make sure you share that commitment. It's a priority to both of you. And then you got to have that trust as well. But all those things that, again, I see now in almost my daily work, I really learned those lessons like that. That's a good segue for us to talk about healthcare. So clearly you're deeply involved in healthcare leadership in the state of Arkansas. And I'd love to hear
and for our group that's in the room with us today, all who represent a variety of different healthcare interests and aspirations and experiences. Maybe some of the healthcare issues you see facing the U.S., certainly even facing Arkansas. What do you see as the major issues?
Yeah, Jeff, and I think there may be like two sets, and I'll try to move it pretty quickly. The first one is really our challenges that we've been dealing with for years ago, and they were really magnified by the COVID-19 pandemic. So the declining health status in our country, especially around chronic conditions. I think 6 out of 10 adults have one chronic condition. 4 out of 10 adults have at least 2 chronic conditions. So we're talking about diabetes, certainly our state is a big issue. You're talking about heart disease, chronic kidney disease. All those things are such a big issue, and certainly obesity, things like that, play a big role in that. So that's one. So we've seen people who have compromised health, who struggle so much with COVID-19. So that's one issue. The second issue is behavioral health. And behavioral health, we were at a crisis stage before the pandemic, and it's only gotten worse over the last 15 months. And when we finally emerge from all this, I'm not sure what we're going to find, but we know it's going to be, I think it's going to be catastrophic when you look at whether it be substance use or whether it be certainly other types of mental illness conditions, mental health conditions that we'll be dealing with. So behavioral health is the second. Third one, unmet social needs. 15% of Americans live in areas that have significant unmet social needs, like food insecurity, they don't have access to reliable transportation. The neighborhoods, the safety, all those types of issues, the whole social determinants of health. And how important that is to good health. And so that's a big issue. The fourth issue is just disparities and racial and ethnic disparities. And we know that COVID-19 didn't affect all Americans in the same way, but that was the case for our country, where people were challenged with being able to access quality health care in the same way. So our healthcare disparity is based on race and ethnicity in particular. Has been a major concern. It's going to continue to be one going forward. Another issue is just access to care. And we used to always think about physical access. And certainly we talked about rural health care earlier, and that's a challenge that we have, access to physical access to care. Well, we've all seen the explosion in telemedicine that's occurred over the last 15 months. It's been an absolutely wonderful thing. I would hate to see where we'd be without it. But you know what? We've got access issues with digital as well. We've got not only access to broadband in some parts of the state, some parts of the country, but also we've got a gap in just digital literacy. And in some populations, just understanding how to work in a digital environment or access to a digital environment. So that's a disparity as well that we need to be thinking of. And then finally, the last thing, just the way that we reimburse for healthcare, which is a fee for service, which we pay anytime a service is actually delivered, we pay a fee. And certainly quality comes into play, but we don't have a way that's really value-based and that really rewards quality and pays incentives to providers to really pursue quality in the way that we need to. So all of those things, those are, I think, 6 areas that have been a concern for a number of years. Just about all of us in healthcare have been working on those in one way or another, but they were certainly magnified over these last 15 months with the pandemic. And I think we're going to see that going forward. So those are areas, those are pretty high-level areas that I think you can see very easily some of the items that fit clearly underneath those that we've got to make progress on going forward. So I think, for us, for our company, I tell you, our future is not about so much about, as it was at one time, about risk selection, risk management, that sort of thing. It really comes down to getting and keeping people healthy. And that should be the goal of the entire healthcare system, is how can we get and keep people healthy? That's going to be what defines success for all of us. So that's one set of challenges right there. Another set of challenges related to, and I think many of you are involved with this, is around innovation. And innovation is exploding right now. And I think all of you know that the supply of innovation, the demand of innovation is exploding. The money that's moving into healthcare is related to that. I mean, everything is exploding. It's a very exciting time. We need new ideas. We need new approaches. We need new technologies. There's absolutely no question about that. But one thing that does concern me is that we've got to find a way to organize and coordinate all this innovation in a way that really addresses those 6 things that I just talked about a minute ago, and provides for a more affordable health system, because that's what we need. So innovation is wonderful, but they can't just be point solutions that exist alone. We've got to bring those together in ways that improve people's lives.
How do you think we do that?
Well, I think that there's a couple of ways we do that, and I think as far as the coordination part and the organization part of it, I think number one is around better alignment. I mean, we have to have that, especially among payers and providers and members and consumers as well. So there's better incentives for getting and keeping people healthy. I think that's one area that's absolutely critical. I think the other part of this is that, I mean, you have to have the information. You have to be able to share data. I mean, certainly interoperability is something we hear a lot about today. We talk about a lot today. It's something that we are behind 100% because we feel it's absolutely critical in order to get and keep people healthy. We've got to have the data. We've got to make data-driven decisions, and we've got to share that with physicians and hospitals and other members of the healthcare system. And we've got to be able to also think of these new approaches in different ways. And let me just add this as well, because telehealth is such a big issue right now. Some telehealth companies fought hard that they want to be paid the same for a telehealth visit as someone who provides it in an office setting, face-to-face. And certainly during the pandemic, we've done that, and we need to do that for a number of reasons. Part of that is to help keep our providers, community strong during this very critical time. But going forward, we've got to ask ourselves, is that really the best way to do this? And so, because if you don't have the cost structure in the telehealth environment that you do, somebody who has bricks and mortar office and all, why shouldn't that cost savings accrue all the way down to the member at some point and all the way through that entire system? So those are some of the issues that we've got to be thinking about.
You talked about data, and I've said this from all the way back to my days at Acxiom, that the advancement of technology and the proliferation of data has far exceeded human adoption and the ability to apply it to significant solutions. What are you guys there at Blue Cross Blue Shield doing to look at technology and data and how to leverage that to some of these problems that we talked about?
Well, one thing we're doing, and really where we're moving toward is to really be a data-driven health solutions company that is focused on getting people healthy. That's where we see our future. And let me just kind of give you an example of kind of how it works. I mean, I could call someone back at the office right now and say, identify the people, the individuals that we cover who are most likely to be on dialysis within 2 years. And we have the data, and we have the artificial intelligence and the algorithms to be able to do that. I'm not talking about getting people's names, but I'm saying they can produce that list and have that information available probably before I got out of the parking lot on my way back. And they would have that information. And we would be able to see that, and you would see, kind of back to what we talked about earlier, it would be dominated by men in their early 60s who are single. Because many of them, whatever reasons, they lack the structure that's needed of somebody to help them either navigate the healthcare system or really be their partner to really help them feel well. That's just a fact. That's what that list would look like. And so then it becomes, okay, so the data-driven, we know who they are, so then how do you begin to engage them? And that's kind of to your point, that's where the challenge is. How do we engage this individual? Okay, we reach out to him, we do call the cell number or this individual, you don't get an answer, you just quit that point. You got to try to engage the physician, get them involved. Do they understand? Because all of this predictive capability is based upon their utilization of care over the previous years or months and gaps in care that are occurring. And so we can see those, can their physicians see them? So can we share them? Can they get them involved in their health care? Is this an issue where you can engage somebody from social services, again, to transportation? Is that what the issue is? Is it a matter of diet? Is all the things that social issues all come together? That's where it all comes together in that case. And so right now, we're still at we're much better at the predictive, kind of to your point, we have the data, using the data, all of the types of analysis that needs to be done. It's the engagement is where we're having a big challenge.
So for everyone that's on Facebook Live, we are with Curtis Barnett, the CEO of Arkansas Blue Cross Blue Shield. If you have questions, we'll give you the opportunity to put those in the comments, and we'll get those in front of Curtis to answer. I would like to open up the floor for any questions that we may have here in the room. We have here.
Your data-driven approaches. Do you ever you find yourself moving to a downstream problem with an upstream solution? Be it that I know this is going to come in the next 2 years, and I know that these demographic at these specific clinics. So I'm going to incentivize the clinics on the front end. Is that what you're saying, or are you? Am I misunderstanding?
No, I think you're saying the right thing. And part of this, I think, kind of where you're at is how do you get ahead of this? So it's basically you're not waiting for somebody to get in that situation. So it is in situations where we are working with the healthcare provider community to share information with them, so they have access to exactly what you're talking about, and they can see from their panel of patients, for example, what are the gaps in care that they may be seeing that may be experienced by their patients, so they can begin to reach out to them before it ever gets to that. Now, in some cases, it gets to that more critical point, and when that happens, it's typically us. Some cases, it's a hospital system, something like that, a care management person who is reaching out to them, who is trying to basically, in some cases, quite frankly, get off the train wreck that you can see is about to occur, because it's a much more critical situation at that point. But what you would like to be able to do is exactly what you said, is get that information in the hands of the people who can affect an outcome absolutely as soon as possible, so they're aware of what's occurring and can make that kind of outreach and work and engage with the patients.
Okay. Thank you. Others? Yes, sir.
You highlighted a lot of problems which are existing right now. What do you think is the top priority to address in the next 5 years?
Top priority for the next 5 years? I can tell you kind of where our focus is, and it really is around bridging that physical medicine, behavioral medicine, social issues, bridging those three things together. I think that's where we are focused right now, and I think that's where we should be focused right now. Because again, a lot of these, so much of the chronic conditions, certainly there's a behavioral health issue, there's underlying behavioral health issue that's contributing to that as well. So if we can't affect that, we're going to have a challenge getting somebody to manage their diabetes, or even, put themselves in a position to avoid getting that diagnosis on the front end. So we've got to do a much better job bridging those, integrating those physical health, behavioral health together, and again, sharing that information, getting those professionals to work together. Again, primary care is a critical part of that, but really more of that whole person approach is where I think the most critical issue is at this point.
Insurance-wide, what are you hearing in the, loop of your world from other companies that you are your competitors for the same problems that they plan on working on, or if they are the same problems?
Yeah, I think they're, certainly your market does have some impact on what the issues are, but I think as an industry, I think it's, those who tend to be the more progressive, probably the ones who I think are seeing the future in very similar ways. I think if there's movement in that direction, by most of the major people who are payers and health plans.
Again, if you're on Facebook Live, please put your questions in the comments, and we'll get those in front of Curtis to answer while we're here. Take a few more questions from the room.
Do you have incentives for Blue Cross Blue Shield to, I guess you'd say, sell or promote to the payers in order to commit to providing physical and behavioral health policies or plans that would better their health?
We do have, mental health parity that became a law back in the early 2000s. So a lot of the discrepancy that occurred that was in place prior to then, where you had maybe physical health benefits were very rich. I mean, typically a lot of companies would, quite frankly, manage behavioral health with a dollar limit at that time. Those went away. And so now there has to be parity between the two. So I think from a coverage standpoint, they're very similar. I think what has been lacking is how do you get those two to work more effectively together? And I think that's where most companies like ourselves are really working to do that. Some of that is through technology. Some of that is through, we have been a major supporter of patient-centered medical home programs with primary care physicians. So again, we try to build into some of our incentive models working with primary care to be sure that they have access to licensed social workers, for example, who can provide that kind of behavioral care. So maybe they can't provide it themselves, or maybe they may not be comfortable in some cases being able to do that. They have access to somebody who can do that. And that's part of what we're working on now. Is it's not just a matter of being sure there's some kind of parity in coverage. You actually got to create processes and approaches and methods to bring those two together. And again, a lot of that's just sharing information back and forth.
What would you say, in your opinion, is the most underserved community in Arkansas, just healthcare wise?
That is, I'm sorry, that's a tough one. I know we've spent a fair amount of time in effort trying to help work with the Hispanic and Marshallese communities up in Northwest Arkansas. In particular, we know there are some, especially when you get into the language barriers and things like that, some cultural differences there that have been particularly challenging. And right now, hopefully you're aware, we're involved in an effort called Vaccinate the Natural State, where we're taking a leadership role to really push, COVID-19 vaccinations throughout the state. We've done it in two ways. One is with really trying to get the business community to be leaders in doing that, because they're trusted by most of their employees. And so hosting, vaccination clinics, or just being a public component of it is a part of it. The other part of it is around underrepresented communities. And I have to say that when you do have basic language barriers and things like that, it becomes a challenge. And you have to think about things, very differently. It's not just when you have language barriers, but faith-based communities, play such an important role. And so you're looking for people you're serving in underserved communities who they trust and who have relationships with them. So it's not Arkansas Blue Cross Blue Shield per se that's going into these communities to do that. What we're trying to do is partner with organizations who have a strong track record and a history of working with these communities, with somebody that they trust and feel very good about, and then how can we help them be successful? So that would probably be the areas, again, Hispanic and Marshallese communities, especially up there. And then I know we've got other populations, Northeast Arkansas, along the River Valley as well. Those would be the ones I think were the most challenging.
Grace?
I was going to say, you mentioned BCMH, and just for the students that are not familiar with that program, can you explain a little bit on PCMH and what people can do back?
Yeah, so it's a patient-centered medical home that's been around for many years as a concept. But probably about 10 to 12 years ago, it really began to gain a lot of interest and notoriety around the country and also in the state of Arkansas in particular. Part of it was driven by, at that time, the Innovation Center associated with CMS really began to promote this. And really what it works to do is create a medical home for patients, really based around primary care. So you are working to attribute a patient population to a primary care physician. So in some cases, it's who you go to naturally. In some cases, we're trying to work with them to direct them to say, this is an effective way to get care, it's an affordable way to get care, to really let that primary care physician guide you through the healthcare system. And so we're working with our members to really help direct them to primary care as being their starting point, because it can help them with preventive health conditions. They're going to have routine checkups, they're having the basic testing that needs to be done. And plus, if they need to see a specialist, rather than self-referring, a primary care physician can help refer them into the system and navigate. Now, as part of that, so we pay them management fees to be able to do this. So there's a revenue stream for doing it. Now, as part of that, primary care clinics who agree to be a patient-centered medical home, they have responsibilities as well. And part of that is 24/7 coverage, for example. So they arrange, it's not just the local emergency, they arrange with other clinics to be able to provide 24/7 coverage for their patients. They agree to basically a team-based approach to care. So we're trying to get the primary care physician to operate at the top of their license. We also want their nursing staff to operate at the top of their license. We want there to be pharmacists that are available to them. We want there to be social workers available to them as well. So there truly is a team-based approach so that when those patients go into that medical home, the vast majority of their healthcare needs are met and they do that. So,
okay. One more question.
You kind of mentioned that you have a lot of data science that you can use to predict, down the line, maybe in multiple years, what could potentially happen with the Arkansas population. In terms of like mental health, you did mention that, that after COVID kind of ends, we might also see an increase in those kinds of problems. What kind of prevention do you think that you could, that you already have prevention, or if there is something that you can enact to help use your data science to like the best of your ability?
yeah, I think the prevention, this is something that we've spent a lot of time on recently. You really have to go back early. I'm talking early intervention. I'm talking about 1 to 3 to 5 year olds, and really talking about now about addressing adverse childhood events and trauma that young children experience that can result in mental health conditions later in life. And so we are looking at some programs now that we can support either through our company. We also have a foundation that can provide support for these types of programs as well. We're working with provider groups to say, okay, when these conditions occur, rather than them being undiagnosed, untreated, and potentially neglected, again, how can you work with the medical community to identify them? And then how can they get them to the appropriate place? How can you get, whenever possible, parents training? Maybe they don't know, maybe it's a lack of knowledge on their behalf in some cases. How can you get them the training and resources they need? So it's really kind of, again, a very much of a holistic approach. When we're talking about prevention and early intervention, you really have to go back to that far back and really to be able to implement that's needed, especially in a state, quite frankly, that has the socioeconomic challenges that we have here in the state of Arkansas.
Thank you.
Curtis, it's been a pleasure having you with us tonight.
Is it already there now?
It's just almost. It goes by quick when you're having fun, right? We really appreciate you for taking your evening out to come and spend time with us and to be our our first guest back as in terms of a live Game Changers event. One thing we didn't mention, so you came here to UCA, you were student government association president, and now you're a member of the board of trusts.
That's right. That's right. We're trustees for the University of Arkansas. Going back to January 2020, so my second year now. So it's been a great experience in getting to know Houston Davis, his leadership team, and the other members of the board. Has really been something that's been very special to me, and it's a humbling opportunity to be a part of that.
Well, we appreciate you for giving back of your time and your talents to do that. I always like to leave with one question tonight, and given that we have a number of aspiring healthcare professionals and leaders, hopefully a number of future healthcare leaders, what one nugget would you leave them with? Take all that experience that you have in healthcare and in healthcare coverage, and what one piece of advice would you give?
Probably the piece of advice that I would give you is you can find your challenge and what excites you. I don't use passion. A lot of people use that term. And I think passion is, my passion is to spend time on the lake or trout fishing or things like that. It's that challenge. And for me, it was that whole issue that I was fortunate to be able to see many years ago with the challenge of providing health insurance coverage for people, the affordable health insurance coverage. That was a challenge. And it's one that's been on my mind ever since. Really that time, almost on a daily basis. It's been a big part of my life. And it's a quest, it's a challenge to be able to do that, something to be working for. So if you can find that challenge, what really excites you that you want to do. And then the second thing is if you can find the culture of a team or an organization that fits with you, with your values, with the things that excite you again, that you think are important. I'll never forget, I've been with Blue Cross for about probably September, so this was in December. We had a company kind of a holiday event, and went to that, and there was such a feeling of community and focus on customer and employer. And I knew right there 28 years ago, I would never leave that company alone. I knew that. I knew I would be there for as long as they would have it. So I had found my challenge, I had found my culture, and to me, that has allowed me to have, whether I've ever been named CEO or not, it's allowed me to have a fulfilling career. And I was having a fulfilling career before I was fortunate enough to be elected CEO. Certainly today, it's a wonderful, wonderful opportunity and a chance for me to make a difference. But if you can find those two things, that challenge and that culture, I do believe you will have a fulfilling career, whatever.
Fantastic. Thank you so much. We appreciate it. It's been an honor visiting with you, and we appreciate it for everything you did.
Great. Thank you, Jeff.
Thank you all. Thanks so much.